Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick nod whether the audio visual is all good. All right, so happy evening everyone, a very good evening. So here we are for the live session. This is after quite some time that we had the last session. So I think that's the reason that I was facing some technical difficulties, forgot the settings and everything. So I hope now that we are here, it should be all good. Right. So today in this session, what we are targeting it is the fast 5 MCQs along with the tricks. These are clinical MCQs, the long stem MCQs that you would be seeing. I hope you have also seen the previous video where I posted the best and the smart resources for microbiology. I hope you are making the best use of those. And microbiology today in this session, because in the ongoing daily targets, we have microbiology, right? So let's start with the discussion. And this is the first question that we have. Please have a look at the question and let me know your answers in the comments, in the live chat. Krishna Kant is asking that is it wise to add all question bank points in first aid as many important topics not covered like sterilization methods and first aid for rapid revision? Absolutely. See, if a topic like sterilization is not there and you think it's going to be quite a few pages of notes that you want to, you'll be making, so what you can do is you can make a separate notebook or in one notebook, you can divide it into sections like subject wise and all those points you can add in that section. So first aid ke saath, you can, have that your extra notebook basically, where instead of making a lot of hopscotch in the first aid itself. Okay, so why do I see a lot of mixed answers here? Very good. Farman, Manisha, Nisar, I can see majority of you have got this right. Now let's have a look at the question. Lengthy questions, I would always suggest look at the last line. What is the most likely causal agent here? And what do we see here is this is a 6-year-old girl had crashed on a ride and pain in the perineal area. Then there was bruising, then there was fever, discoloration, and there was blebs. It went on to involve the leg, thigh, and buttock also. And then she died. That means basically this is a fast progression is what we are seeing here in this case. Like we are seeing a fast progression. And apart from that, the discoloration and the blebs after the injury with the piece of wood in the perineum, this is highly suggestive of myonecrosis. Okay, so basically we are talking about myonecrosis here, the muscular necrosis here, and the causative agent for that is Clostridium perfringens, right? Clostridium perfringens is the causative agent. Now the question is not directly asking, this is a two-step question basically, where it is asking that what is true about Clostridium perfringens? Now, few important points about Clostridium perfringens is that is it aerobic or it is anaerobic? Remember that it is anaerobic. Okay, it is anaerobic. So at least remember the three anaerobes, if not all. Which are the three anaerobes? The mnemonic to remember the anaerobes is, remember A, B, and C. So A is actinomyces, right? Nocardia, actinomyces, the branching filaments. Out of that, actinomyces is anaerobic. B is bacteroids, fragilis, and C is Clostridium. Okay, remember this mnemonic for anaerobes. So basically we have for anaerobes, it is A, B, C. Okay, it is A, B, C, which is the trick that you need to remember. So it is anaerobic. Is it gram positive or gram negative? It is gram positive. It is not gram negative. It is gram positive. And remember another point, perfringens is the one which perforates, right? It perforates. So remember that perforates, matlab it lyses the membrane, because basically it has lecithinase, phospholipase. What toxin is that? Basically the lecithinase, that is what toxin that is? Alpha toxin, beta toxin, theta toxin. Remember that is a alpha toxin. Okay, that's an alpha toxin. And another important point for Clostridium is that it causes double zone of hemolysis. Okay, that is another important point that you should remember. Double hemolysis, or basically target hemolysis, is what we would be seeing with Clostridium perfringens. All these are the important points that we should know. So looking at the options here, what are the options saying? The first option is requires an elevated oxidation reduction potential. Elevated oxidation reduction potential basically means that it is an aerobe. No, Clostridium is anaerobe. It is not gram negative, it is gram positive. It is a marked lecithinase producer. Yes, it is. It is non-hemolytic. No, it shows target hemolysis or double zone of hemolysis. So the correct answer here is C. That means it's a marked lecithinase producer. And what test do we basically do for this lecithinase? To identify Clostridium perfringens, that means it is producing lecithinase. What reaction it is? That is the Naegler's reaction. Okay, that is the Naegler's reaction. So now tell me that Naegler's reaction, this is another important question recently asked. Naegler's reaction is an example of neutralization, or is it complement fixation? What kind of test is Naegler's? Okay, remember that Naegler's, N for N, Naegler's is neutralization. Okay, Naegler's is an example of neutralization. Okay, remember N for N. Naegler's is neutralization. So let's have a quick review of all these important points here basically. So that is Clostridium perfringens. This is an important image where you can see those blebs, right? And then what is this one showing? What is this image showing? This image is basically showing the Naegler's reaction. What do we have in Naegler's reaction? On one side, we have the anti-alpha toxin. On the other side, there is no anti-toxin. So where we have the anti-alpha toxin, you don't see that reaction. Where there is no anti-toxin, so the lecithinase causing the lysis, and that is how we will see this reaction, right? So there will be opacification due to lecithinase activity in the half where there is no antitoxin. So one side there is the antitoxin, one side there is no antitoxin, that is Naegler's reaction, which is neutralization. So all these are the important points for Clostridium. Please keep in mind that it is basically gram positive. Okay, it is gram positive bacillus. Stormy clot reaction and target hemolysis, that is double zone of hemolysis, is what it shows, the double zone of hemolysis. Then you have, remember also the reverse camp test. Okay, it shows the reverse camp test positive. Streptococcus agalacti is your camp test. Clostridium is reverse camp test. Then you have Naegler's reaction, and then you have the gas gangrene. Okay, so these are all the important points summarized for Clostridium. Remember, it is gram positive, anaerobic, target hemolysis, Naegler's reaction, right? All this is important. Let's go to the next question now. Okay, this is the next question. Please have a look and tell me what do you think will be answer to this one. Okay, so this is where I was expecting that a lot of us would be making mistake, and this is what we are seeing here. Who's getting it right? Farman, very good. I think only Farman so far has got it right. Now, to everybody's surprise, the correct answer here is coagulase production. Why coagulase production? Tell me why coagulase production. What is the condition that we are talking about? So here you have the very important keyword which is there is diffuse epidermal peeling and sometimes pustular lesions. So basically there are skin lesions here that are mentioned, and this is basically staphylococcal scalded skin syndrome. Scalded peeling is basically, remember, the scalded skin is what we are talking about. So that is the scalded skin syndrome which is caused by Staph aureus. Now tell me that which of these options is the most specific for Staph aureus? Is it catalase production or it is coagulase production? All staphylococcus will be catalase positive. So be it Staph aureus, Staph epidermidis, or be it the other Staph saprophyticus also. But only Staph aureus is the one which will be coagulase positive. Okay, only Staph aureus would be coagulase positive, and that is why the answer here is D. Remember that even though it's catalase positive, but the most specific is coagulase positive. Tell me the other ones. Which one is bacitracin sensitive? Which is bacitracin sensitive? So remember the mnemonic here, that is basically B bras. Okay, that is B bras. What is B bras? So B bras basically stands for that bacitracin test. Group B streptococcus is resistant. Group A streptococcus is sensitive. Okay, group A is sensitive. So now tell me that, right, so which is group B and group A? Streptococcus pyogenes. We'll see the flow chart, that's going to be sensitive. Bile soluble, very, very important. This is a very important question. Bile solubility is a feature of Streptococcus pneumoniae. Okay, that is Streptococcus pneumoniae is bile soluble. You can remember it as bile. Where is the bile present? Bile is present in the GIT. Coming from the biliary tract, it goes into the duodenum, so it's present in the GIT. So whatever is present in the GIT, that organism will be bile resistant. That means it is used to the company of bile. It will not get dissolved by bile. Bile solubility means it cannot tolerate bile and it gets dissolved. So remember Streptococcus pneumoniae. Pneumoniae means lungs wala, intestine wala nahi. So that is bile soluble. Catalase production. What is the mnemonic for catalase positive organism? Remember the mnemonic for catalase is capillase. Okay, can remember it as capillase. So you have Candida, you have aureus, that is Staph aureus, Pseudomonas, Aspergillus, right, Listeria. These Serratia, these are basically catalase positive. So Staph is catalase positive. Coagulase is specifically about Staph aureus. So that's the answer. Optogen sensitive. Remember optogen P for P? That is again Streptococcus pneumoniae. Okay, optogen is Streptococcus pneumoniae. Okay. So look at this flow chart here, which tells you about the gram-positive cocci, that is Staph and Strepto. Out of that, Staffy cat. Remember the name of the cat, that is catalase, is Staffy. So Staffy is catalase positive. Even in that, coagulase positive is only Staph aureus, the rest are negative. Staph epidermidis is novobiocene sensitive. Remember something which is on the epidermis, you put the ointment like novobiocene and it is sensitive. Saprophyticus is resistant. Okay, saprophyticus is resistant. That is what we need to know here. In Streptococcus, alpha, beta, gamma hemolytic, optogen sensitive P for P is pneumoniae, viridans is resistant, B bras, that means BR. Group B Streptococcus is resistant, Group A is sensitive. Group A basically includes your Streptococcus pyogenes, and Group B Streptococcus is your Streptococcus agalacti. Neonatal meningitis, it's an important cause there. For group D, that is no hemolytic, gamma hemolytic, we look for the growth in NaCl, 6.5%. NaCl If it is present, it is fecalis. If not, it is bovis. Okay. Remember, 6.5% NaCl is your fecalis. Okay, that is fecalis in NaCl. Bovis is not in NaCl. Right. So this is the flow chart that we need to remember. Very, very important. So remember, for Staph aureus, it is coagulase production. Okay, it is coagulase production. Staph aureus ke liye, which are the culture media that we use? Remember the mnemonic from our culture media? Staphylococcus staphy is cat. Cat ko we call saying Lulu. That is Ludlam salt wala. And you also have mannitol salt agar. Okay. So you call the cat saying Lulu, and the cat comes to drink the milk. So when the cat is drinking the milk, the cat realizes that there is salt in the milk. Okay, there is salt in the milk. Basically, these are the media basically for Staph aureus. Okay, so Ludlam's and mannitol salt agar. Catalase is capillase. C for Candida. Okay, remember Candida, Aspergillus. Then you have Pseudomonas. A for aureus, Staph aureus, and S for Serratia. Okay, so these are the ones, the most important that you should remember for catalase positive. Okay, so that was the second question. Let's go to the next one. That is the third question here. Let's try answering this. A very, very important question. So the 5 questions that I've included here are the ones, like, these are the important topics. Most important point which is given here is microaerophilic, gram-negative, curved rod. Polar flagella often in pairs that gives a seagull appearance, right? So what organism is this? It grows at 42 degrees centigrade. So the contamination was probably due to what? What organism is this? This is very, very important, and you should never forget this in microbiology. What is going to be the answer here? Right, that is poultry. What is the organism? Basically, we are talking about Campylobacter jejuni here. Okay, we are talking about Campylobacter jejuni here. What are the features? All the features that are mentioned here. Microaerophilic, gram-negative, curved rod, and 42 degrees centigrade. Whenever you see 42 degrees centigrade, microaerophilic organism, you should always think about Campylobacter jejuni. What does it have association with? Very, very important. It has association with GBS, the Guillain-Barré syndrome. It's a very important cause of bloody diarrhea in children, right? It's an important cause of bloody diarrhea in children, Campylobacter jejuni. And the contamination source generally with Campylobacter jejuni is the poultry. Okay, the poultry, that's the meat and sometimes the milk. Let's have a look at this. The important points, this is basically from first aid. So the important points for Campylobacter jejuni, what are those? It's gram-negative, right? It is comma or S-shaped. It can be comma or S-shaped like this with polar flagella. Remember, this is oxidase positive. All these curved organisms, they are oxidase positive, grows at 42 degrees centigrade, right? Remember, Campylobacter likes the hot campfire. So high temperatures, that is 42. So Campylobacter likes the hot campfire. Major cause of bloody diarrhea, especially in children, fecal oral transmission is there, or it's because of ingestion of poultry or meat, which is undercooked, contaminated, or unpasteurized milk as well. Association with Guillain-Barré syndrome and reactive arthritis, that is Reiter syndrome. I mean, what are the culture media for Campylobacter? We had seen this mnemonic. What is the story mnemonic for this culture media of Campylobacter? So Campylobacter is like going on a camp, right? So who's going on a camp? this butchard, that is the butchler, butchard going on a camp basically to hunt for a sparrow, okay, to hunt for a sparrow. So imagine that this is the camp, this is the butchard, and he has gone to hunt for the sparrow. So you have Campylobacter medium, Campylobacter, butchard is the butchler, and sparrow is the sparrows. What kind of motility do we see with Campylobacter? What kind of motility is seen with Campylobacter? Right, very good. Sayed. It's also to add to the medium, I'll come to that. We have the Cva medium also. Okay, I'll come to that. What kind of motility do we see? It is darting motility. Okay, Vibrio and Campylobacter is a darting motility. So imagine that this butchard, when he's targeting for the sparrow, it's like playing the dart game. Okay, the dart that is targeting dart pay. So remember, it is the darting motility. And remember, to add to the medium, you have Cva medium also. What is the Cva medium? Basically, you can remember this as when this butchard was going to kill or hunt for the sparrow, he suddenly got a CVA attack. That's a cerebrovascular accident. Okay, so he got a CVA attack and he could not hunt for the sparrow. So all these are the media for Campylobacter. Okay, so that was this question on Campylobacter. You get a question very, very frequently. Remember, 42 degrees centigrade campfire, microaerophilic oxidase positive GBS association, all this is there. Okay. All right. So this was about this question. I want to go to the next question, which is this. Just give me a minute. We were... Right. So let's try answering the next question here. "45-year-old man presents with shortness of breath and productive cough. His sputum was gelatinous and bloody. Gram stain reveals numerous PMNs and the gram-negative rods. Which of the following is most likely to fit to the patient?" So tell me first, what is the causative organism here that we are talking about? What is the causative organism here that we are talking about? So gelatinous bloody sputum. That is basically the red currant jelly sputum. Okay, that's your red currant jelly sputum, which is a feature of Klebsiella pneumoniae, right? Klebsiella pneumoniae, Friedlander's bacillus. Red currant jelly sputum is Klebsiella. Now, Klebsiella is gram negative, so it fits into this. Why do you get this currant jelly sputum with Klebsiella? Because basically, if you see, it produces a lot of mucus. It has highly mucoid colonies, right? It's mucoid colonies, those are there. Apart from that, remember that it is urease positive. These are the important points for Klebsiella. Remember, it is urease positive. And whenever you talk about urease positive organisms, what kidney stones comes to your mind? Urease positive organisms is basically true white stones, right? The triple ammonium phosphate, that is the true white stones. Is it a lactose fermenter or a lactose non-fermenter? Klebsiella, is it a lactose fermenter or a lactose non-fermenter? Remember, Klebsiella, the KLE, usko rearrange karenge, तो it will be LEK. Remember that it is lactose fermenter. It's a fast lactose fermenter. Is it enveloped? Yes, it's an enveloped organism. So the envelope is itself responsible for the mucoid colonies. Remember, it's a lactose fermenter. E. coli and Klebsiella are lactose fermenters. Okay. So Klebsiella pneumonia is basically seen in alcoholics or basically due to aspiration. Okay, it's seen because of aspiration. Alcoholic patients may, diabetic patients may, it is very common. So alcoholic and diabetics with aspiration, Klebsiella pneumonia is common. What is the radiological sign that we see with Klebsiella? Remember that because of the mucoid, a lot of mucoid colonies, viscous sputum, it causes a pressure on the fissure. So the fissure which should have been horizontal, right? We have the horizontal fissure here. You can see that the fissure is bulging down. Okay, this limiting fissure is bulging down. Ideally, it should have been horizontal like this. So we see the bulging fissure sign. Okay, remember it is one of the causes of bulging fissure sign, though not the only one. That is Klebsiella pneumonia. Okay, Klebsiella is your bulging fissure sign. Apart from that, look at the colonies here, highly mucoid colonies. Klebsiella is gram negative, stays in the intestine, can cause lobar pneumonia in alcoholic and diabetics when aspirated. Very mucoid colonies because of the polysaccharide capsule. The current jelly sputum is what it causes. Also can cause UTI. Okay, also can cause UTI. Okay, so remember these are the points about Klebsiella. And remember, it is alcoholic diabetic patients with aspiration. Klebsiella is the cause that we should think about. Okay, molar tooth colonies is seen with actinomyces. Okay, the molar tooth colonies is seen with actinomyces. All right. Coming to the last question in the fast five. This is the fifth question here. Tell me, what do you think about this question here? A 6-year-old girl presents to the emergency department with fever and a lacy body rash. Okay. Mother says that yesterday the rash was only on her face, but by this morning it has spread to the trunk and extremities. What is the most likely cause here? First, it was the rash on the face. Now it has gone to the body. It's the lacy body rash. I see a lot of confusion here. So this is not a direct, like easy one, it seems. This is not measles. I see majority of you writing this as measles. This is not measles. What is this? Why this is not measles? Because measles will have your cough, coryza. There would be history of conjunctivitis. All these are important features. There would be Koplik spots, very very important. Koplik spots ये सब होगा. ये measles नहीं है. इसमें coryza, cough, conjunctivitis कुछ नहीं दिया है. It's only the rash on the face and fever, and now to the trunk. So this is Parvo virus B19. Okay, B19 here is basically your Parvo virus. Classically, right, it causes your slabbed cheek appearance, erythema infectiosum, the fifth disease, slabbed cheek appearance. Then it goes to the body and it gives the lacy body rash, right? Remember that this is Parvo virus B19. First it is on the face, then it goes on the trunk. That is called as the lacy rash. So now tell me that Parvo virus is basically a DNA virus or a RNA virus. We have seen the classification, the mnemonics. Remember, it's a DNA virus, single-stranded. That's the unique feature of Parvo virus. It is a single-stranded DNA. Remember that Parvo is Parvo. DNA है, Parvo single-stranded है. Then the rest of them are double-stranded DNA. Okay, it's a single-stranded DNA. Enveloped or non-enveloped virus? It is non-enveloped. So remember, Parvo single-stranded hai or Parvo without envelope hai. It is a naked virus. It's a non-enveloped virus. What cells does it bind to? What is the receptor for Parvo virus? Remember P for P. That is the P antigen on the RBCs. And that is why it attacks the RBCs. So it causes what? It causes your aplastic crisis. Okay, very very important question. It causes aplastic crisis, and it can also cause hydrops fetalis. Okay, it can cause hydrops fetalis as well. So very important. Remember, this is Parvo virus, fifth disease, slabbed cheek appearance. This is what you see here, the slabbed cheek appearance classically of the fifth disease. Remember, Parvo virus has no envelope. Single-stranded linear DNA virus. It's the smallest DNA virus. Aplastic crisis in sickle cell disease, slap cheek rash. There is erythema infectiosum, fifth disease. Infects the RBC precursors, that is P antigen, and leads to hydrops fetalis. It can also lead to pure RBC aplasia and also rheumatoid arthritis-like symptoms in adults. Okay. So remember, all these are the, yes, it's the non-immune variety of hydrops fetalis. All these are the very, very important points for parvovirus. This is not HHV6 because in HHV6, you have a patient, there's generally the history of febrile seizures as well. and then comes the rash, right? Then comes the rash, that is what we have here in HHV6, roseola infantum, right? Roseola infantum. Rubella may, we have this occipital or post-auricular lymphadenopathy as well, which is common, okay? All right. So now the final point here, the final tip here, the mnemonic for the day. How do you identify? Okay, tell me, what is this? This was asked in one of the recent exams. Is this Borrelia? Is this Treponema? Or is this Leptospira? What do you think is this? Borrelia, Leptospira, or this is Treponema? So where you have the hooked ends, okay, the ends are hooked. Remember, that is Leptospira. Okay, this is how you identify Leptospira. So how to differentiate the three spirochetes is basically, remember, Treponema, it has this closed wala, okay, the curves which are there, it is closed. And remember, Treponema is basically straight, okay, it is straight and it has these, the curves. Borrelia is like a wide bore. Okay, the curves which are there, they are very far away. Okay, they are wide. It's a wide bore that you see. In दोनों में hook नहीं होता है, the hooked ends are not there. Lepto, remember, is like lapeto. Lepto is like lapeto. So हम इसको लपेट रहे हैं. So it has this hooked ends. Okay, so the very characteristic finding of Leptospira would be the hooked ends. Okay, that would be the hooked ends. So remember, that's about Leptospira. अगर दूर दूर होंगे तो वो होगा Borrelia, पास में होंगे तो Treponema, and if it has the hooked ends, then it is basically Leptospira. Okay, the hooked ends is Leptospira. So that is about the today's session, guys. This was the fast 5 MCQs with the tricks and the mnemonics. We will have a part 2 of that tomorrow. I'll keep you posted on the Telegram group regarding the same. Okay. So thank you so much and goodbye. Take care and keep studying, keep revising and keep winning. Thank you.